So let's face it. Okay, we all hate flossing. Even I am not a super huge fan of it, but I know how important it is to my health and well-being, so I make sure I floss. We know it's important, and yet nearly everyone is struggling to floss, and if they are flossing, then they're not actually doing it very well. So let me see if today I can make it easier for you and give you some advice and show you some easier and better ways to floss. But why is flossing important? What's up with flossing? Why do I need to floss? Why is my hygienist and my dentist always banging on at me about flossing? Well, when you brush, you can't actually clean in between your teeth. So there's parts of your teeth that sit side by side and next to each other that don't get clean. And this means that about 40% of your teeth surfaces don't get cleaned when you only use a toothbrush. Now that's going to be a bit like taking a shower and not washing your armpits or those other important areas. Yeah. So moving along, flossing helps freshen your breath. It helps prevent cavities and gum disease and heart disease. Yes, it's true. If you have gum disease in your mouth and your gums bleed, that's like having an open sore elsewhere in your body. And there are loads of blood vessels in your gums, and there is a link between gum disease and heart disease. Think about it. Because all your blood vessels are connected to your heart, and all the blood that flows through every part of your body goes through your heart. If you have an infection in your mouth, that infection will spread to your heart as well as the rest of your body, like your brain. And gum disease is even linked to dementia as well as heart disease, guys. And this is why I'm really passionate about flossing. We want to keep our gums healthy, and by flossing, that's a way to do it, and I'm going to recommend it to everyone. Flossing is one of the most simplest things you could do to help your heart. Think about it like your cardio workout for the day. Yeah, I know, bit of a stretch, but it is. It's helping with your heart health. And I'm going to show you how to properly floss. Now, a lot of people tell me that they're flossing, but they're still missing cleaning in between their teeth properly because they don't floss correctly. And I get it. I honestly used to think that all you did with floss was you go up and down, up and down, up and down. You get in between the two teeth and you go up and down, but that's not correct. It's not helping your gums, and you are simply wasting your time. So I'm going to give you a demo of how to floss, okay? Now, there's how to do it and there's how not to do it. So how not to do it is where the floss is just going up and down and it's snapping into the gums and you're going ka-ching, ka-ching, ka-ching with the floss. That's not cleaning anything, guys, and it's going to hurt your gums. Basically, you want to slide and guide the floss in an up and down motion to get in between that contact area between the teeth where they touch. Then you need to curve the floss round your teeth so that you're hugging the tooth with the floss, and then you move the floss in up and down motions to scrape the sides of your teeth, and you do it gently. So you go up and down, and then you push the floss up under the gum line without snapping it into the gum. Do it slowly and do it steadily. Don't rush it. Do this between every single tooth in your mouth, even the very back edge of the furthest most back tooth, because you got to clean down the back of that as well. Make sure you do that, even though it doesn't have a tooth next to it. It's really important to get round the back of that tooth and touch the gums. When you stimulate the gums with floss and toothbrushing, it makes them healthy. So get right back there. Don't be slack. Make sure you're hugging the teeth, and then it's going to be worth your while. You'll actually want to scrape the plaque off the tooth and disturb the biofilm with your floss. The goal of flossing is not just to remove food from in between your teeth. That's a bit of an added bonus. You really want to do is to remove the plaque. Stop it leading to an infection between the teeth. And that's where bacteria really like to hide. Still not interested in flossing? Don't want to look after your heart? Don't want to have clean armpits and bits? Well, okay, let's put it this way. Bacteria in your mouth eat sugar. And then those bacteria poop all over your teeth and gums. Nice. That poop is acidic and it will cause cavities, and the bacteria will also cause gum infections. So you can think of flossing a bit like wiping your butt after you've had a poop. Sorry to go there, but you wouldn't want poop all over your teeth or your mouth now, would you? I can see everybody running, reaching for the floss, blowing off the dust out of the back of the cupboard. Anyway, you want to remove the bacteria every night before you go to sleep, because that's when those bacteria in all those dark places where they hide that you can't reach, they get super active and they're having sex and they're reproducing and they're pooping all over your mouth. So if you want to floss for fresh breath and healthy gums and prevent decay and to keep bug poop off your teeth, then don't be lazy. Use your floss properly and hug your teeth with the floss, and do the very back edge of every tooth with the floss each night. Think of it like getting a towel and towel drying your back, and that's going to make flossing more easily. Now I've got my chart here. I don't know how well that's going to show up on the screen with the light there for you, but hopefully you can see how that person's putting the floss up in between the teeth and curving it round the tooth. Now I'm going to have a go at doing it for you. I'll get my bit of floss here. Ba-ching. So this is a bit short, you'd have it longer. You wrap it round and you hold it on your thumbs and between your thumb and your finger, and then you can guide it and go up. Can't see what I'm doing. Go up, curve, you see? And go up and down. Can't do it without being in the mirror, but I hope that wasn't too disgusting. I've now got bug poop on my hands, so I'm going to have to go and use some antibacterial. Hope that wasn't too disgusting, and it's given you an idea of why you should floss. Let's try it on the model, and yes, I will sanitize the model afterwards. I'm going to get a fresh piece of floss. Don't worry, this is my personal roll of floss that I keep in my bag and carry around with me because I am anal. Let's see if we can do this. This is my model that I use for practicing my braces on. So we go up between the teeth. Oh, I don't know if we can on these models. Hang on. Should have practiced this beforehand, perhaps. Here we go. We go in between the teeth there. Got a little bit too much to hold. And then I'm wrapping it back on itself. I hope you can see that. And then we just slide up and down. Now, I might just go and see if I can find some stock video footage for you and add that on the end, and that'll help you floss more easily. So floss to prevent decay, prevent gum disease and mouth infections, look after your heart, and get rid of that bug poop out of your mouth. I'm Dr. Rachel of Evolve Dental. Please like, comment and share.